If you're planning to retire before 65, there are 5 health insurance mistakes that could cost you tens of thousands of dollars, or worse, wipe out years of savings before you even get to Medicare. And here's what makes this so dangerous. These aren't mistakes that careless people make. These are mistakes smart, financially prepared people make because the system is so complex and confusing. And almost nobody connects the dots until it's too late. Today, I'm going to walk you through each one, what it is, what it costs, and exactly how to avoid it. If you're new here, hi, I'm Elle. I'm a retired attorney with 32 years in practice. I manage my own residential and commercial properties. I also owned an art gallery before I retired the second time. This channel is about helping you design retirement well and on your own terms. Let's get into it. Mistake number 1, defaulting to COBRA without doing the math. When you leave your job, your employer will hand you a COBRA packet, and most people just sign it because it's familiar. Same plan, same doctors, no disruption. It feels safe. But COBRA is almost always the most expensive option on the table, and people don't realize it until they've already burned through thousands of dollars. Here's why. While you were employed, your employer was covering a significant portion of your health insurance premiums, typically 70 to 85% of it. Under COBRA, you pay the entire premium yourself, plus a 2% administration fee. For 2026, that means individual COBRA coverage is running anywhere from $600 to $800 a month. For families, you're looking at $1,500 to $2,000 or more. That's $18,000 to $24,000 a year for a family out of your pocket with no employer contribution. And here's what most people don't consider. COBRA lasts a maximum of 18 months in most cases, so it's not even a long-term solution. It's an expensive bridge to nowhere if you don't plan what comes next. The alternative, for most people, it's the ACA marketplace. Depending on your income, and this is key, depending on how you manage your income, you could qualify for premium subsidies that dramatically reduce your cost. We're talking potentially hundreds of dollars a month in savings compared to COBRA. For the same or comparable coverage, the fix is simple. Before you sign that COBRA packet, go to healthcare.gov and run the numbers. Compare COBRA to what's available on the ACA marketplace with your projected retirement income. You have 60 days after leaving your job to elect COBRA, and losing employer coverage qualifies you for a special enrollment period on the marketplace. Use that window to make an informed decision, not a reflexive one. Mistake number 2, ignoring the ACA subsidy cliff. This is the mistake that catches most people off guard, and for 2026, it's even more dangerous than it's been in years. ACA premium subsidies are based on your modified adjusted gross income, your MAGI. If your MAGI falls between 100 and 400% of the federal poverty level, you qualify for subsidies that can reduce your premiums significantly. For a single person in 2026, that means keeping your MAGI below $62,600. For a couple, below $84,600. For a family of 4, below $128,600. Now, here's the critical change. From 2021 through 2025, Congress had enhanced these subsidies and eliminated the hard cutoff at 400%. Subsidies gradually decreased as your income rose. There was no cliff. That's over. For 2026, the enhanced subsidies have expired. The cliff is back. That means if your MAGI exceeds 400% of the federal poverty level by even $1, you lose all subsidy eligibility. Not reduced subsidies, zero, gone. Let me put real numbers on this. A 60-year-old couple earning $84,000 might pay $600 a month for a silver plan with subsidies. That same couple at $85,000, just $1,000 more in income, could be paying $2,500 a month or more for the same coverage. That's an additional $22,800 a year in premiums because of just $1,000 more in income. And here's what trips people up. Your Magi isn't just what you withdraw from your accounts to live on. It includes capital gains from selling investments, dividends from your brokerage account, interest income, distributions from traditional IRAs, and 401ks. Even a Roth conversion counts as income for Magi purposes. Your portfolio can push you over the cliff without you spending a dime of it. Here's the fix. Know your number. Before the year starts, project your Magi for the year and know exactly where that cliff is. Work with a financial planner or a tax professional who understands ACA subsidy thresholds. This is important. And be intentional about which accounts you pull from and when. This is income sequencing, and it can save you 5 figures a year. Mistake number 3, doing Roth conversions without checking the healthcare math. This is the one that makes me crazy because the people making this mistake are doing everything else right. They've saved well, they're thinking long term, they're doing Roth conversions to reduce future tax liability. Smart move, but in a vacuum. In early retirement, a Roth conversion is not just a tax event. It's a healthcare cost event. And most people, and honestly, most financial advisors, don't model both sides. Here's what happens. You retire at 60. Your spending is modest. Your Magi is naturally low, which qualifies you for great ACA subsidies. But then you or your tax advisor says, now is the perfect time to convert some of that traditional IRA to Roth while you're in a low tax bracket. And it is, from a tax perspective. So you convert $50,000. Makes sense on paper. Except that $50,000 shows up as income on your tax return. Now your Magi jumps from $55,000 to $105,000. You've just blown past the $62,600 subsidy cliff for a single person by more than $40,000. Your ACA subsidies disappear entirely. Your health insurance premiums could increase by $15,000 to $20,000 for the year. So you saved maybe $6,000 in future taxes on that Roth conversion, but you paid $15,000 more in healthcare premiums this year. That's not a tax strategy. That's math failure. The fix? Before executing any Roth conversion, calculate the impact on your Magi relative to the ACA subsidy cliff. Model the tax savings of the conversion against the healthcare premium increase. Often the right answer is smaller conversions, maybe $5,000 to $10,000 at a time. That keeps you just under the cliff. Or concentrating larger conversions in years when your income is unusually low for other reasons. The conversion isn't wrong. The timing and amount might be. Mistake number 4, not planning for IRMAA 2-year lookback. The first 3 mistakes happen before you turn 65. This one hits the moment you get to Medicare, and it's caused by decisions you made 2 years earlier. IRMAA stands for Income-Related Monthly Adjustment Amount. It's a surcharge on your Medicare Part B and Part D premiums if your income exceeds certain thresholds. And unlike tax brackets, IRMAA is a cliff system. $1 over the line and you pay the full surcharge for that entire tier. For 2026, The standard Medicare Part B premium is $202.90 a month. That's what you pay if your MAGI is $109,000 or below as a single filer, or $218,000 or below filing jointly. But as a single filer, go $1 over $109,000 and your Part B premium jumps to $284.10 a month. That's an extra $975 a year. And it goes up from there at the highest bracket above $500,000 single or $750,000 joint. You're paying $689.90 a month just for Part B. That's nearly $8,300 a year per person, plus Part D surcharges of up to $91 a month on top of that. But here's the part that catches people. IRMAA is based on your income from 2 years prior. Your 2026 Medicare premiums are determined by your 2024 tax return. So if you sold a property in 2024, did a large Roth conversion in 2024, or had an unusually high income year in 2024 for any reason, you're paying for it now in 2026 through higher Medicare premiums. And there's nothing you can do about it after the fact. The tax return is filed. The number is locked in. This is why the years between 63 and 65 are some of the most important planning years in your entire financial life. What you do with your income at 63 determines what you pay for Medicare at 65. What you do at 64 sets your premiums at 66. The fix? Start managing your MAGI with IRMAA in mind at least 2 full years before you turn 65. If you're doing Roth conversions, time them carefully. If you're selling assets, consider spreading the gains across multiple years. And if you get hit with an IRMAA surcharge because of a one-time life event, like retirement, the death of a spouse, selling a business, you can appeal using Form SSA-44 through Social Security. Most people don't know this exists. It could save you thousands. Mistake number 5, having no healthcare bridge strategy. This is the mistake that ties all the others together. Most people plan their retirement finances in one bucket and their health care in another. They figure out their savings withdrawal rate, they project their expenses, they plan for Social Security timing, and then when it comes to health care, they just say, I'll figure it out. That is not a strategy. That's winging it. And winging it is expensive when the system has this many tripwires. A healthcare bridge strategy means having a year-by-year plan that covers the entire gap between employer-sponsored coverage and Medicare. It answers specific questions. What coverage will I have in year 1? What will it cost? Where is my income coming from, and how will that income affect my premiums? What's my MAGI target for each year? When should I do Roth conversions, and how much? What happens if I have an unexpected capital gain? What's my contingency if premiums spike? And then it connects that plan to your Medicare transition, modeling IRMAA exposure for the first 2 to 3 years of Medicare based on the income decisions you're making right now. The people who get this right save tens of thousands, sometimes 6 figures, over a decade of retirement. The people who don't are the ones writing comments on videos like this saying, I had no idea it would cost this much. Here's the fix. Build a healthcare bridge plan. Sit down either yourself or with a fee-only financial planner who specializes in early retirement and map out every year from your last day of work through at least age 67. Include your income sources, your MAGI projections, your ACA subsidy eligibility, your Roth conversion schedule, and your IRMAA exposure. One integrated plan, not 5 separate spreadsheets that don't talk to each other. Let me bring this all together. If you're retiring before 65, here are your 5 tripwires. 1, don't default to COBRA. Run the numbers against the marketplace first. 2, know the ACA subsidy cliff. For 2026, it's $62,600 for a single person, $1 over, and you lose everything. 3, never do a Roth conversion without modeling the healthcare impact. The tax savings might cost you more in premiums. 4, manage your income from IRMAA in mind, starting at least 2 years before Medicare kicks in. Your decisions at 63 set your premiums at 65. And 5, build an actual healthcare bridge strategy, year by year, integrated with your finances, no gaps. This is what designing retirement looks like, not just knowing your number, but understanding how every system connects and where the hidden costs are buried. If this helped you see something you would have missed, subscribe. I'm here every week going deeper on retirement than most people are willing to go. And if you want personalized help designing your retirement, check the link in the description for a one-on-one consultation with me. I'll see you in the next one.